Hi, this is Ann Stoneson, a beginning counselor, building your ideal internship. And today I'm here with the latest installment in our interview series, Internship Tips, where we speak with experts in the field about what they think you need to know in order to have a successful internship. And today I'm delighted to introduce you to Rajani Venkatraman Levis, who's a licensed marriage and family therapist in San Francisco in private practice. She is also a certified trauma specialist and trained in EMDR, and she also works with LMFT interns in California as a supervisor. And she's a counselor educator, so she has a lot that recommends her for our talk today. And she's going to be speaking with us today about what she thinks y'all need to know about private practice in order to succeed in internship. In addition to all of these things, Rajani also has put together a wonderful resource that I want to tell you about, and we'll include more information at the end of today's talk so you can follow up about it. She's got a website called talkingaboutTherapy.com, wherein she talks about how clinicians can build a private practice. She's compiled a lot of really great resources. That's all there for free for you. It's really a labor of love, and it's just wonderful. So let's go ahead and dive in. Thank you so much for being here with us today. Welcome.
Thank you so much for having me. Yay!
Yay! So glad you're here.
I have to say that it's still hard to sit with a therapist face and listen to myself being introduced. I don't think I've quite figured out the therapist face for that one yet, but I'm working on it.
It looks pretty good to me from where I'm sitting, so good job. Yeah. So we've got some really important information. And, when we talked about the topic for today, the idea of doing, a conversation about private practice with interns, it's a little bit backwards, you would think initially. And that really kind of intrigued me, your pitch for the talk, because mostly people are doing internship after, or rather they're doing private practice after internship, or maybe in tandem with their internship if their state and their supervisor provide that to happen. So I was delighted to hear about the topic and just want to know more about your take on all of this. So where would you like to start?
I think I'd like to start with two stories because I love stories. That's how I learn, and in therapy I use a lot of stories in talking with clients. And so there are two stories about first sessions in private practice. And the first one's a little bit more somber, so we'll start with that one, and the second one's much more lighthearted.
Okay.
So the first story is that a dear colleague of mine was seeing a couple for the first session, and halfway through the session she noticed herself starting to feel lightheaded and dizzy and a little bit nauseous. And she said, I'm just going to push through it, just as we therapists usually do. And moments later, she knew something was wrong and tried to stand up and collapsed. She woke up when the paramedics arrived. Turned out to be a small infection, nothing major, but she was in the middle of a first session, and her clients were the ones who had to call 911 to get the paramedics in.
Oh, wow.
And so we were in this consult group, and she says, oh my God, how do I contact them now? I feel mortified.
Oh.
Right? So it's a story about our shared humanity.
Yes.
We're all very human.
Mm-hmm.
And these things happen to all of us. Just because I'm a therapist doesn't mean I'm not going to be subject to the same ills as my clients, right?
That's the truth.
So the second story is one that my friend Tamara Tucker generously shared with me and said was generously shared with her. There was a very esteemed, well-known older therapist. And one day she was ushering in these new clients who were very nervous into her room. So she ushers them to the couch and then turns around to go to her seat and trips over the bunched up rug and ends up with her head in the seat of the couch and lets out a loud fart.
Oh my gosh. Wow.
And I love this story because make what you will of it, right? It's almost like a Zen koan for a monk. Like, contemplate this.
Yes.
What do you make of this?
Yes.
And there's something of value in that for all of us, that we mustn't let ourselves be caught up in some idea of therapist perfection. And that the only thing that allows us to do the work that we do is that we are together in this shared humanity of our farts and our fainting and our anger and shadow side and ill-temperedness and all of that, right?
Yes, absolutely true. This is what makes us good therapists, is our humanity and embracing that. I think many beginning counselors are nervous about that and feel they must be perfect or put their best foot forward or you have their therapist face, as I call it, when in fact it's when we can be vulnerable, that we can really do our best work, I think.
Right. And so these are my two favorite beginner stories of what do we do with this vulnerability? How do we then step forward? Mm-hmm. We hear the term corrective emotional experience a lot, right? Yeah. And so here's a moment for the therapist and the clients together to have corrective emotional experiences.
Ooh, it's not just for them. Though, of course, they're at the heart of the work, but how can we not be moved and changed by it ourselves?
Exactly.
And celebrating that. Yes. 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 I'm so with you on all of this.
Right. And so that was kind of the goal of sharing these two stories, is to name that these sorts of things happen in private practice all the time. And I know when I suggested, what can you learn from private practice in order to have a successful internship, it sounded like it was ass backwards. And so hence a fart story.
Of course. No question.
And this is what we get to learn from private practice, is that we don't have to be perfect, that we get to learn these incredible skills of relating to our own humanity, that what we need is that place where we integrate our personal and our professional selves, right? Yes. Each of these therapists' personal self was really in the room as they then called their clients and said, let's talk about what happened, as they then worked through these events. And that this is what a really successful internship can help us learn, right? How do we integrate these pieces of our shared humanity, of our personal and professional identities? And learning. Go ahead.
This is the first step of that. It's such a tender time, and I'm curious, especially as a counselor educator, if you have thoughts about what can support that learning, because I think depending on who we're mentored by and who we're taught by, we may get more or less support in this way of working versus having this fear about I must be perfect, or what if my supervisor doesn't like what I'm doing in the room, or I feel often criticized by my professors, or things like that.
Beautiful question. So several years ago, my colleague Laura Siniego, Veronica Gold, and I wrote this article which is posted on Talking About Therapy, and I'm sure Anne will post a link to it after.
Yes.
And this is called Can Do It. We came up with an acronym where the letters CANDOIT stand for what we can do to work through those pieces that you just mentioned. Mm. So we know that clinical competence is the baseline, right? You cannot be a good therapist without learning those skills of clinical competence. But sometimes you're not getting adequate support from your site, from your supervisor. You're not getting the right training. Mm-hmm. What can you do? Well, advocate for yourself. Mm-hmm. That's the A. Mm-hmm. It's just like we advocate for our clients, it's actually really important that we practice that skill for ourselves. Mm. Learning to ask for what we need, not just giving up and saying, oh, my supervisor sucks. They don't give me the training that I need, but to say, have I had these conversations? Have I talked with my supervisor and said, here's what I really need support with? Mm-hmm. I'm getting behind on my paperwork. Mm-hmm. Can you really give me another tutorial on how our documentation works? Mm. I hear that all my notes are getting kicked back, but I don't understand how to do them so they won't get kicked back. Mm-hmm. Right? Mm-hmm. My caseload is too high. Mm. I'm afraid that you will see me as incompetent if I tell you my caseload is too high. Mm. So can we have a conversation about that? Mm. So learning to kind of advocate for ourselves is a big piece of what we can do. Mm-hmm. Learning to advocate for, if you're in a big agency, actually, I would like a different supervisor between group and individual so that I can learn more. Mm-hmm. Mm-hmm. Recognizing the pieces that we are getting And then the N stands for networking. Right? This is a big piece of what we do in private practice.
Absolutely. It's integral if you're to be in private practice to be able to network and build relationships.
But that starts when we are already in our internship. Yeah. And people hate the word networking. People get really intimidated, right? And so I often say, think about this. As therapists, we may not all be business people. We may not all be tech people. But we are all fundamentally people. And that's what it means to network. Is be a people person in the way that you are a people person.
Yes.
Whatever that is for you, that's the way that you network. It doesn't look like how anybody else does it. Mm-hmm. And these are the people who are going to help you build an ideal private practice for you. So, make these contacts, enjoy them, appreciate them, build on them. Mm-hmm. And then the D in the can do it stands for diplomacy. So, it's very hard to end up with your head in the seat of the couch and farting and then learn to be diplomatic about it. And yet, learning to really own that and stand in your own poise and say, wow, that was really embarrassing. How was that for you?
Yes. Yes, absolutely.
Learning to be diplomatic at your site placement and not to see that as a problem, but to really recognize that as an opportunity for I am learning this really important skill that will support me through the rest of my career.
Yes. Yes, and not just one's career, but life in general. I mean, and most of us, I like to think, come to this field already with some of these skills already not fully in place, but on their way. Right. But yeah, this one serves lifelong, I think. And I want to make sure we don't miss the C, because I asked you a question and you told me about the A for advocacy. What's the C in CAN?
Oh, the clinical competence.
Oh, of course. That's you already covered that. Okay, good. Okay,
no, good. I'm glad you asked. Other people might be wondering too.
No, you just dove right in and I was like, okay, no, perfect. All right. So D is for diplomacy. Okay.
Yes.
Okay, love it.
Yeah. And also that piece about, okay, so you have maybe a very good supervisor that you learn skills from, and then you have a supervisor who is not a good fit, or maybe their skills are not up to par. What do you learn from that supervisor? Mm-hmm. Well, you learn what not to do.
Yes.
Because a few years from now, you will probably be a supervisor, and now you have learned such a valuable lesson of what you would like not to do, not to repeat. Mm-hmm.
A big part of our work is knowing what not to do, or knowing about timing, or being able to own things. And if you have a supervisor with whom you've tried to talk about concerns and they have not been receptive, then you get that perhaps painful but very valuable lesson about what is it that I want to cultivate with my clients, that they can really bring anything to me. And if I become a supervisor, how can I do the same for my supervisees? Because it's such tender territory, what people are bringing to us, whether we're a supervisor or functioning as a clinician. And so yeah, I really think your point is spot on about learning what not to do, and that can also be useful learning, even if it can be frustrating at the time.
Right. Which is kind of the same that's true for our clients. Mm-hmm. They're coming to us telling us, this is a really painful, horrible thing, and I wish I didn't have to learn a life lesson through this horrible experience. And we say to them, well, I'm glad that you don't have to do this again then.
Right. Precisely. So we've got a few minutes left, and I want to hear the O and the I and T. So tell me what's next.
So the O is about optimism.
Ooh, that's a big one.
It's hard to really kind of move through these hours of your internship feeling like you're not making money, you have all the student loan, you don't know where it's going, and learning to stay optimistic, knowing that all of these experiences are useful. Mm-hmm. They are teaching you something about a potential future client's life experience. Mm-hmm. And so don't let these experiences be wasted on you.
Yes. Well, and this ties into what we talk about over at our new project with Beginning Counselor, which is internship doesn't have to be another hoop to jump through. And
that's right.
If you're framing it that way, then you're missing out on a really fantastic opportunity. Even though I can certainly understand the frustration that can come with some of these lessons and how they can be hard-won and frustrating at times. But yes. Okay, so O for optimism. That's huge, and we really try to furnish that in our community because it can be a long road through internship, and so having support along the way is so important.
Right. So that brings us to the I, which is about integration, which is what we were talking about earlier, right? The integration of our personal and professional identities. And that the internship is that playground in which it happens.
I love that idea. Internship is a playground. That's fantastic. And so true. And so true in many ways. It is a safe place to play and explore. You're working under someone else's license, someone else's oversight and supervision, and it's a chance to finally do all the things you've been learning about in school.
Right. And to learn to work with new populations and be like, oh, I really like addictions. Or, wow, I really find it very distressing to work with a domestic violence survivor. You know, learning those pieces as you bring it together is really helpful. And the T in all of it, which I think some folks might guess, is therapy, your own therapy, right?
Yes. So important.
Absolutely. That each of us learns how to be a therapist from sitting on the other side of the couch.
Yes.
Right? Sitting on the couch and having the therapist who sits with us and learning, oh, this is what it feels like to be raw, to be vulnerable, to be scared, to wonder if someone's judging me.
Yes.
This is what my transference feels like, right? But how do we learn about transference and countertransference without really experiencing all the shades of it?
Right, and not being the one in charge of that conversation or wrangling that. As the client, we are given permission to really rest in our experience and to learn from that. Yeah.
Right. And so learning about the challenge of, as you just put it, resting in our experience, right? Learning how hard that is makes it easier for us to empathize when our clients are like, yeah, no, that's it. I don't really know.
I'm not going there. Not going there today.
Yeah, I feel fine.
Everything's great, more or less. Tell me more about that. Meh.
I don't know.
Yeah. Well, and I think also the value of participating in our own therapy as therapists in training and therapists throughout our careers. You know, there's this piece too about internalizing the experience of being helped. So it's not only cultivating understanding and compassion for our clients and their struggles and their hardships as we know what it's like to sit on that side of the room and in that couch. It's also knowing deeply what it is like to be helped. Because sometimes people say, gosh, I think that this works. It's a neat profession, but I'm not sure. Or what does the helping look like? Or what does that feel like? Or does it mean I need to give them some solutions? Not necessarily. And so being able to know, again, that felt sense of being helped in therapy and what that's like, it's hard to teach that. I think it's something that's more experienced. So that's a great way to wrap up the acronym. It's one's own therapy. Yeah.
You know, like you said, the question, does therapy really help? We can't know if we haven't been helped by it. Well put, Anne.
So we've got about a minute or two more, and there's so much more we could say on this, but I want to see if there's anything else that you want to cover or close with that you think our group needs to know as they're going through internship and thinking about private practice.
I would say I love this phrase, the pre-licensee paradox, that my friend Laura Siniego wrote a piece about, which is also posted on the Talking About Therapy website, where when we are the earliest in our career, raw, green, really just learning, we often face some of the most difficult cases.
Yes.
That we don't yet have the bandwidth for, but that other more experienced people can actually reject those cases because they have more say-so.
Yes.
And so this pre-licensee paradox of being so fresh and young and vulnerable and being exposed to really high levels of trauma or criticality in cases is an opportunity for us to really embrace self-care.
Yes.
And I can't end this interview without really emphasizing how little effort it can take to start to practice a little bit of self-care. When you stand in front of your closet in the morning, pick something you want to wear and tell yourself, this is part of my self-care. It doesn't have to be, I need a weekend away for a spa date. If we keep waiting, we put off the self-care.
That's the truth. Yes. And
so start small.
Yes. Start small. If you start at all, and please do start, because this is a skill also, as many of these that you have pointed out, will endure throughout your career. Yes. So self-care, I'm glad that you mentioned that, because it's something that I think as therapists, depending, we can sometimes give lip service to it, but it's so, so crucial if you're to have any staying power in this profession.
Absolutely. Absolutely. Just that morning cup of tea or coffee. Sit with your coffee, and love the warmth of the cup and,
Yeah.
sip at it gently and enjoy the flavor and the warmth coming in. Say to yourself, these 5 minutes today are my self-care.
Mm-hmm. So it's
So little breaks.
yes,
Yeah.
little breaks. I like that. It doesn't have to be something big and grand. Oftentimes then it's just postponed and then we're tapped out. So, there's so much more we could say here, but we need to wrap up. But I did want to say I'm just so grateful to you for taking the time today to speak with our group. And I'm delighted to tell our viewers that there's so much more to this conversation that she has put out online for us. And there's a full article actually that goes more in depth about this idea of the can do it. And I've read it and I highly recommend it. So I will include the link so that you can go right to it. And don't forget, too, about her great website. She's got her private practice website, which, of course, you're welcome to check out. And if you're in San Francisco, you may seek her out. But the talkingaboutTherapy.com is a really great resource for practice building as well. So thank you so much for taking the time to meet with me today. We so appreciate you.
Thank you so much. And to all of you who are watching, you can do it.
Yes, you can do it. That's the message, y'all. You can do it. Thank you so much for being with us today, and we'll see you next time.